Wait for few minutes. Madam will be coming. Don't go anywhere.
ఏం సార్ ఇది వెరైటీగా తీసుకుని సార్ ఏంటిది ఇది
యూట్యూబ్ స్ట్రీమింగ్ క్లాస్.
ఓ మై మెడిసిటీ
తీసుకుంటారా మీరు క్లాస్?
మేడం
ఊకంటే కష్టం కదా సార్. ఊకే ఎట్లా మనం చేయాలంటే కొద్దిగా అంటే కొద్దిగా
వాళ్ళు చూసుకుంటారు. మేడం ఉన్నది సీనియర్ మోస్ట్ మేడం.
మేడం కొద్దిగా తెలుసుకోవాలి కదా ఇవన్నీ. సిస్టమ్దే కదా వచ్చి టక్కని తీసుకుంటే అయిపోతుంది. పిల్లలంటే కష్టం.
చిన్న సౌండ్ కూడా క్యాచ్ చేస్తారు సార్. అందుకోసమే మేము మళ్ళీ క్లాస్ తీసుకుంటప్పుడు జర సైలెంట్ అనమాట. చిన్న అక్కడ మాట్లాడినా ఇక్కడ వినపడతారు. చాలా సెన్సిటివ్ అన్నట్టు.
కాలేజ్ కూడా సెన్సిటివ్.
Wait for few minutes. Madam is coming. Don't go anywhere. Wait for few minutes. Madam is coming. Don't go anywhere. Let's start.
చెప్పేసుకోండి. ఓకే. డిస్కంటిన్యూ అవ్వదు కదా సార్. 1 hour కంటిన్యూ
లేదు మళ్ళీ డిస్కనెక్ట్ చేసి కనెక్ట్ చేశాను.
ఇప్పుడు స్టార్ స్ట్రీమింగ్ చేయాలా సార్? రెడీ ఉందా సార్? ఓకే. వస్తుంది. Okay, good morning students. Today I am going to continue with the enzymes. So in the previous class of enzymes already we have discussed about the classification of enzymes, how the enzymes have been classified and the factors affecting enzyme action, and even we have discussed about the enzyme inhibition like competitive inhibition, non-competitive inhibition, uncompetitive, suicide inhibition, etc. So today here I am going to explain you like isoenzymes. So isoenzymes means here a few enzymes has diagnostic importance. So that means estimation of those enzymes is useful in diagnosing the various disorders. So those enzymes we can call it as diagnostic enzymes, and most of the diagnostic enzymes are isoenzymes. Okay, and coming to this PPT, already you know that enzymes are proteins, and proteins which has got catalytic activity, those you can call it as an enzyme. And enzyme, you know the enzyme action, like enzyme combines with the substrate to form enzyme substrate complex that will be further catalyzed to enzyme plus product. So enzyme role is just to speed up the rate of the reaction. So at the end of the reaction, products are formed. And you know that already always substrate will go and bind to the enzyme at specific site. Okay, enzyme always substrate will go into the bind to the enzyme at specific site. That site you can call it as active site. Okay, and here few enzymes are there, and other than the active site, okay, another site is there. That site you can call it as allosteric site. Okay, general properties of enzymes is, already you know that during the enzymatic reaction the substrate has a specific place on the enzyme. So that place on enzyme is known as active site. But few enzymes are there along with the active sites, other site is there, that site you can call it as allosteric site. Okay, so this here the purple one, okay, the lavender one is the like allosteric site. This one is the active site. Active site meant for the binding of substrate, but allosteric bind is here sometimes allosteric modulators. Okay, if positive one occupies here, this will activate the enzyme activity. Sometimes if few negative modifiers are there, if they bind to this site, they will inactivate the enzyme. So like that, enzyme action is regulated, okay, based on the allosteric site. Okay, allosteric enzymes means those enzymes which are having an extra site other than active site is known as allosteric enzymes. So this is the allosteric site. Okay, presence binding of the allosteric modifiers regulate the enzyme activity. If positive modifiers occupies, stimulates enzyme activity. If negative one occupies here, which will inhibit the enzyme activity. Okay, and coming to the next one is isoenzymes. So isoenzymes means these are also enzymes, okay, but they are differ in their that differ in amino acid sequence but catalyze the same chemical reaction. So that means isoenzymes means these are multiple forms of the same enzyme. All the forms will catalyze the same reaction, but they may differ in their amino acid sequence, right? You already know that enzymes are nothing but proteins only. You all know that proteins are made up of amino acids. So enzymes are all the different types of enzymes, okay, different multiple forms of the enzymes catalyze the same biochemical reaction, but they differ in their amino acid sequence. Those enzymes we can call it as isoenzymes. Okay, now called isoform of an enzyme. So they have similar catalytic activity, but they are different biochemically or immunologically and can be demonstrated. So all the isoenzymes can be, you can separate them by electrophoresis, and differences in absorption property or by the reaction with the specific antibody. Okay, so now what you have to understand in this slide is isoenzymes, multiple forms of the same enzyme. Okay, all the forms catalyze the same biochemical reaction, but only the difference between the one form and another form is their amino acid sequence, right? And all the isoenzymes can be separated by electrophoresis. Now here already you know that cofactors. Cofactors means here the non-protein molecule of the enzyme required for activation is known as cofactor. Already I mentioned in the earlier classes, enzymes are fully functional when some cofactors are attached to that. That means holoenzyme means it is composed of protein plus non-protein part. The non-protein part you can call it as cofactor. The cofactor may be coenzyme or activator. Okay, if metals as the activator, metals are the non-protein part, you can call it as activators. If active forms of the B complex vitamins or act as the non-protein part, that you can call it as coenzymes. And you already know the enzyme classification, already how the enzymes have been classified. Okay, few enzymes are already, you know, the main classification, but here few enzymes are plasma and few enzymes are non-plasma specific enzymes. That means few are available in your plasma and few are not available not non-plasma. Okay, and plasma specific enzymes have a specific function in the plasma. Okay, those enzymes which are present in the those enzymes which are present in the plasma, they have specific function in the plasma only. So example, plasma is normal site of an action for these enzymes. Okay, and concentration in plasma is greater than the most tissues, and often are liver synthesized. Most of the plasma enzymes are synthesized by the liver. Examples are plasmin and thrombin. So these are the plasma specific enzymes. Okay, plasma specific enzymes means these are active in the plasma because their concentration is more in the plasma, and moreover their site of action is in the plasma only, and most of the plasma enzymes are synthesized by the liver, and examples are plasmin and thrombin. Okay, and the other type of enzymes are, few enzymes are non-plasma specific enzymes. That means they have no physiological role in the, no physiological function in the plasma, and these non-plasma specific enzymes are secreted into the plasma. Okay, and a number of enzymes are associated with the cell metabolism, and these are normally found in the plasma only in the low concentration. Okay, non-plasma means usually they are secreted into the plasma, right, and their concentration is very low in the plasma. Okay, and the sources of non-plasma enzyme is mostly these non-plasma enzymes from cells during the normal process of breakdown. They may be formed during the normal process of breakdown and replacement, and higher concentration mainly seen, okay, during the injury or death of the cell tissues. Right, here usually the non-plasma specific enzyme, their concentration is very low. Okay, but here their concentration might be high because of the injury of that particular tissues or the cell death or altered membrane permeability that may occur with the inflammation. Okay, if there is inflammation is there, what will happen? There is altered permeability of the cell membrane is there, then the enzymes which may be enter into the plasma, these enzymes may be present. Okay, so here an increased plasma concentration of these enzymes is associated with the disruption of the death. Okay, normally plasma enzymes are active in the plasma only, but non-plasma specific enzymes are there, their concentration is very low in the plasma, right, normal healthy conditions, and these are secreted into the plasma. Okay, and their concentration, the non-plasma specific enzyme concentration is increased, particularly diseased conditions, pathological conditions, and already you know the normal classification and factors affecting enzyme action, and generally the enzymes has been measured. The enzymes are not directly measured, they are commonly measured in terms of catalytic activity. Then how do you measure the enzyme activity? And generally they are not measured, but usually they are measured by their catalytic activity, and we don't measure the molecules, we measure how much work it performs. So how many enzymes are there, that generally we don't measure. Generally what we measure is how far it works. Okay, so the rate at which it catalyzes the conversion of substrate to product. Okay, generally we are estimating enzymes, because few enzymes, their concentration is increased in the blood, has the diagnostic importance. When you estimate the enzyme directly, we won't estimate the how many number of enzymes are there in your plasma blood. Okay, patient sample. Only what we measure, what we will determine is, we will just measure the catalytic activity. Catalytic activity is nothing but in terms of how far it will convert the substrate to products. So the enzyme activity is a reflection of its concentration, and this activity is proportional to its concentration, right? How much of the rate of the reaction is there, so that is directly proportional to concentration of the enzymes. And generally photometric measurement of the activity, this enzyme activity generally we do measure by increase of products, decrease of substrate, decrease of coenzyme, or increase of altered coenzyme generally. Okay, see enzyme activity, how do you measure means, generally products, if more products are there means more active, more catalytic catalysis done. And if there is decrease of the substrate, okay, the already substrates are, the concentration is decreased means already they might have been converted to products. So decreased substrates or increased products or the decrease the availability of coenzyme, that also increases the indicates the enzyme activity, and even increase of the altered coenzyme. So if substrate and coenzymes are in if substrate and coenzymes are in excess concentration, the reaction rate is controlled by the enzyme activity, right? If substrate and coenzyme both are in excess concentration, substrate is there, coenzyme both are excess concentration, means what does it indicate? The reaction rate is means that indicates the enzyme activity is decreased. Okay, suppose if more substrates are there, more coenzymes are there, that indicates decreased enzyme activity. So measuring of the enzyme activity is generally we do measure the NADH and NAD because they will absorb the light at 340 nanometers, and increased NADH concentration in a solute will cause the absorbance of the change. This is not necessary for you. And generally how do you measure this enzyme activity? Means one of the two general methods may be used to measure the enzyme activities. One is fixed time. Fixed time means here we will measure at specified time, okay, and the reactants are combined, the reaction proceed for designated time, and the reaction is stopped usually by inactivating the enzyme within with a weak acid, and a measurement is made of the amount of the reaction that has occurred. Okay, generally there are two types. The enzyme activity can be measured by kinetic method and fixed time. Okay, like enzyme activity in the diagnostic labs, there is measured by two, fixed time and kinetic assay. Fixed time means here fixed time, a specific time only we will measure. Here the reactants, substrates are combined, the reaction proceeded means we will see the enzyme activity in the given time, and then normal the reaction is usually stopped by inactivating the enzyme. Okay, so after 1 week purposefully by using one acid we will stop the enzyme activity and then measure the amount of the reaction that has occurred. Like that, fixed time means that nothing but we are measuring the enzyme activity at a fixed time. Okay, so after the fixed time the enzyme activity is decreased or completely stopped by using a weak acid, then we do measure the amount of the reaction that has occurred. And the second one is the continuous monitoring or the kinetic assay. So here what we will do is, here enzyme activity is measured, is recorded by the spectrophotometer. Means by using the spectrophotometer we do measure the kinetic activity, and measurements of the here what we will do is we will measure the absorbance change that made means as the reaction is taking place there is a change in the absorbance. The change in the absorbance we do measure by this spectrophotometer. So measure at specific time intervals, usually 0, 30, 60, like means for every 30 seconds we do observe what is the change in the absorbance. That change in the absorbance can be measured by spectrophotometer. So like that, enzyme activity is measured by kinetic method using the spectrophotometer or by using the fixed time. Okay, then coming to the units, how do you express the enzyme activity? So generally enzyme activity we do express in IU per liter. IU is international unit per liter. Okay, generally the enzyme activity can be measured by IU per liter, that is international units per liter. Okay, and so IU means what? The amount of the enzyme that will convert 1 micromole of the substrate per minute in a specified conditions. Okay, so you should know the definition why we have to express enzymes in international units per liter. Means here IU means this is the amount of the enzyme that will convert 1 micromole of the substrate per minute in a specified conditions. Usually we do usually reported in IU per liter. So generally SI units, that is Catal, sometimes we do express standard international units is Catal, that is moles per second of the substrate converted per second. Okay, and these are the units. And coming to the major enzymes of clinical significance. Okay, please note down this. These are the diagnostic enzymes. So generally each enzyme has certain concentration in the blood. So that is due to the wear and tear of the tissues. These enzyme concentration normal will be there. Okay, some concentrations will be there. Increase of these enzymes may be suggestive of the diagnostic importance. Right here, whatever the enzymes here mentioned here are the diagnostic enzymes. clinically important enzymes. Why these are called diagnostic enzymes means due to wear and tear of the tissue, some concentration of these enzymes are there. Those are the normal ranges. If there is any pathological conditions is there, if any damage occurs to the particular tissue, their concentration is going to increase in the blood. So increased concentration of these blood could be suggestive of various pathological conditions. For example, you see the first one, acid phosphatase. Acid phosphatase is here it is as ACP, that is ACP is acid phosphatase, that is drastically increased in prostatic carcinoma. Okay, and another one ALT, alanine transaminase, that is increased in hepatic disorders. And the next one is ALP, that is alkaline phosphatase, which one is increased in hepatic disorders. And amylase, this is increased in acute pancreatitis. Okay, and AST increased in myocardial infarction, hepatic disorders and skeletal muscle disorder. Please note down this slide. This one is important for you even in the future also. See here the two enzymes ALT and AST. ALT, alanine transaminase, that will increase in the hepatic disorders. ALP, that is alkaline phosphatase, that concentration is increased in hepatic disorders. Amylase concentration is increased in acute pancreatitis. Okay, ACP is acid phosphatase, increased in prostatic cancer. And creatinine kinase, this is one of the enzyme, increased in myocardial infarction and muscular dystrophies. The next one is in gamma glutamyl GGT, that is gamma glutamyl transferase, that is elevated especially in the chronic alcoholics. Okay, GGT, gamma glutamyl transpeptidase, that may be increased in chronic alcoholics. And glucose 6-phosphate dehydrogenase, that is G6P, that is increased in drug induced hemolytic anemia. And lactate dehydrogenase, this is an enzyme, its concentration is increased in myocardial infarction, hepatic disorders and carcinoma. Okay, so these are the list of the enzymes. Their increase of the particular enzyme may be suggestive of the clinical conditions. Please note down this. These are the diagnostic enzymes, clinically important enzymes. Then coming to in that clinical enzymes, few are isoenzymes. Few isoenzymes means already I mentioned those enzymes. Okay, isoenzymes means already I mentioned those enzymes are exist in the multiple forms, catalyze all the chemical reactions, but they may be different in their amino acid sequence. But few isoenzymes has diagnostic importance. Here examples creatine kinase, lactate dehydrogenase and alkaline phosphatase. Okay, out of all these diagnostic enzymes, 3 are isoenzymes. Examples are ALP, alkaline phosphatase. Okay, examples are alkaline phosphatase, creatine kinase and then lactate dehydrogenase. These 3 are the examples of the isoenzymes. Then coming to the creatine kinase, action of this enzyme is associated with the generation and storage of high energy. You know that creatine kinase means it generally phosphorylates creatine to creatine phosphate, right? Creatine phosphate is the energy for muscle contraction. Okay, in the muscle there is an enzyme is there by name creatine kinase. What is the role of this enzyme? This will convert creatine to creatine phosphate. What is this creatine phosphate? It is a reserve source of energy for muscle contraction, right? And the creatine kinase is an isoenzyme. It is present in 3 places: skeletal muscle, cardiac muscle and brain. Okay, creatine kinase is mostly present in, it has 3 isoenzymes. One of the isoenzyme is present in skeletal muscle, others may be there in the cardiac muscle and brain. So increased creatine kinase especially useful to diagnose AMIS, okay, that is myocardial infarction, acute myocardial infarctions and skeletal muscle dystrophies. Okay, please remember creatine kinase is one of the isoenzyme. This enzyme is available in 3 places, okay, location, okay, 3 tissues: skeletal muscle, cardiac muscle and brain. Okay, there are 3 types of are there, that is CK. What are the 3 types of isoenzymes are CKBB, CKMB and CKMM. I mentioned no, creatine kinase, what is the reaction? It converts creatine to creatine phosphate. and it may be present in 3 tissues: brain, cardiac, heart and muscle. So there are 3 isoenzymes are there for creatine kinase. What are the 3 types of isoenzymes? CKBB, that is brain; CKMB, that is present in heart; and CKMM, that is present in the skeletal muscle. Okay, right here that means increase of the CKBB concentration suggestive of brain damage. Increase the CKMB, CK2, increased concentration of CK2 suggestive of myocardial infarction, and increased concentration of the CK3, that is CKMM, could be suggestive of muscular dystrophies. Okay, usually skeletal muscle creatine kinase is 99% of the creatine kinase is available in the skeletal muscle. That's what creatine kinase is elevated means. First that could be suggestive of the muscular dystrophies. Okay, that's it about this one. And the next one is the even in the myocardial infarction also there is increase of this acute myocardial infarction also. There is increase of this creatine kinase. Okay, so post acute myocardial infarction, what will happen? CKMB, that increases 4 to 8 hours post EMI. Okay, after the onset of the chest pain, acute myocardial infarction, this enzyme concentration rise to increase after 4 hours, and peak will reach at the 12 to 24 hours, and this will come to the normal in 48 to 72 hours later. Okay, please note down CKMB, where it is present in the heart. Its concentration is going to increase in the myocardial infarction. After post myocardial infarction, if you estimate this concentration after the onset of the MI, this enzyme concentration is going to increase 4 to 8 hours. Okay, start increasing 4 hours, and peak will be reaching 12 to 24 hours. The level will come to normal after 48 to 72 hours. Okay, and the next one is which specimen we have to use is, usually we have to use serum, heparin or plasma for this estimation of the creatine kinase. Okay, and the next one is the interference of this creatine kinase is RBCs. Erythrocytes has lacked, there is no creatine kinase, but hemolyzed RBCs, they release adenylate kinase. Okay, and this is not necessary for you. And coming to the next one is next isoenzyme is lactate dehydrogenase. One of the isoenzyme is creatine kinase. Already in the previous slide, first I told you the list of the diagnostic enzymes. Okay, that you have to by heart, all the enzymes with their significance. And the next what we are discussing is isoenzymes. Okay, in the diagnostic enzymes only few are isoenzymes. One example already we have discussed, creatine kinase. The second one is lactate dehydrogenase. So lactate dehydrogenase, generally it catalyzes the reaction conversion of pyruvate to lactate, where NAD acts as the coenzyme. Okay, mostly this lactate dehydrogenase, it is present in the heart, liver, muscle, kidney and RBC. Okay, it may be, this enzyme is available in 5 places, 5 locations: heart, okay, cardiac muscle, liver, skeletal muscle, kidney and RBCs. So less small amount of this may be there in the lungs, smooth muscles and brain, elevated with the disease above this one. Okay, usually LDH level is elevated in the hepatic disorders or the myocardial infarction and in the hemolytic disorders. Okay, and this LDH I mentioned, it is an isoenzyme. It has got 5 forms: LDH 1, 2, 3, 4 and 5. Okay, this LDH isoenzyme has 5 forms are there: 1, 2, 3, 4 and 5. LDH1 is present in the heart, LDH2 is present in the RBC, 3 is present in the lung, and 4 is present in the liver and skeletal muscle, and 5 is present in the hepatic and skeletal muscle. Okay, it is there. Okay, LD5 is exclusively, mostly it is present in the skeletal muscle. When coming to the LD1 is present in the cardiac muscle. So increased concentration of the LD1 could be suggestive of LD1 where it is present in the skeletal muscle, cardiac muscle. So increased concentration of the LD1 could be suggestive of myocardial infarction. Increased concentration of LD5, see the location, skeletal muscle. So increased concentration of LD5 could be suggestive of muscular dystrophies. Okay, like that this can be in the heart problems. The concentration of the LDH is increased 2 to 10 times more than the normal concentration. Okay, and that's it about this one. And This specimen, okay, this specimen used for this one is serum or heparin. The normal concentration of the LDH is 45 to 100 international units per liter. RBCs have 100 times more than amount of the LDH. Okay, after the onset of the myocardial infarction, LDH level begin to rise after 12 to 24 hours. What about your CK? Within 4 hours only the enzyme levels are going to increase, but in acute myocardial infarction the level is going to increase 12 hours. And here the peak will be reached in 48 to 72 hours, and this level remains high for 10 days. Okay. And then now coming to the clinical significance of this one is the measurement of serum concentration of the LD has proven to be useful. Okay, the measurement of serum concentration of LD is proven to be useful in the diagnosis of myocardial infarction. And the LD, okay, lactate dehydrogenase enzyme active in the serum, it does not rise as much as CK or AST after myocardial infarction. Usually after the onset of the myocardial infarction, the first enzyme to rise is CK, followed by LH and then AST. And this is quite important when the patient does not see a physician for 3 to 4 days following an infarction. Okay, after the onset also, if the patient he won't visit the doctor, this will be helpful. That's it about the diagnostic enzymes. Okay, with this enzyme chapter is finished. Okay, in this chapter you have to read about the definition of an enzyme, classification of an enzyme, factors affecting an enzyme action, enzyme inhibition of the enzyme, and the diagnostic enzymes, and the last one is the isoenzymes. So with this chapter is finished. Then we'll move on to the next one, like lipid metabolism. In the lipid metabolism already I have finished the lipid chemistry. Then other small topics are there. Let me finish for you in this chapter. Give me 1 minute time. Okay, yeah, already lipids means already you know that. Coming to the digestion of the lipids, so already you know the definition of the lipids. Lipids are insoluble in water, soluble in organic solvents. Okay, and the lipids, how they have been classified lipids. Okay, and digestion of the lipids means here, lipids means these are the group of heterogeneous compounds, and these lipids may be soluble in organic solvents and insoluble in oils. Okay, insoluble in water. And the lipids are mainly classified into simple lipids, compound lipids, and derived lipids. Under simple lipids, okay, and the lipids are mainly classified into 3 types: simple lipids, compound lipids, derived lipids. Simple lipids means these are the ones which are fats comes under that one. Derived lipids means along with the fats some non-fatty acid substances are present. Those are called compound lipids. Examples are lipoproteins, sulfur means phospholipids, then the sulfur lipids, etc. And the derived lipids means they are derived either from the simple or from the compound. Example is cholesterol, free fatty acids, etc. Now coming to the digestion and absorption of the lipids. So the majority of the lipids what you take in the diet is mostly 80% it is made up of triacylglycerol, cholesterol and phospholipids. Okay, so digestion means now we are discussing about how the lipids are digested into. Digestion is nothing but breakdown of the complex ones into simpler ones, right? Digestion means it is the process of breakdown of the complex ones into simpler ones. So now we are discussing about the digestion of the lipids. So prior to absorption, lipids whatever you have taken in the diet need to undergo digestion. So the major dietary lipids are triacylglycerol, cholesterol, phospholipids, etc. Triacylglycerol means already you know that 3 fatty acids condenses with 1 molecule of glycerol to form triacylglycerol. Okay, 3 molecules of fatty acids condenses with 1 molecule of glycerol to form triacylglycerol, and another fatty acids what we take in the diet or cholesterol, phospholipids, etc. Now digestion in the mouth is here. Generally, first let us discuss about the digestion of the lipids in the mouth. So there is very little amount of the lipid digestion takes place in the mouth because of the absence, because of the presence of lingual lipase. Okay, lingual lipase action continues in the stomach also. It acts mainly on short chain triglycerols. Okay, so digestion, little digestion of the mainly which lipids need to undergo digestion: phospholipids, cholesterol, and triglycerides. So in the triglyceride, digestion begins in the mouth only with the help of the enzyme lingual lipase, but due to the short stay of the food in the mouth, only some amount of the triglyceride only can be digested by lipase, which is present in the saliva. But due to the after that food from the mouth, the food bolus then enter into the stomach. So there the action of the lingual lipase already it may be continue in the stomach. It may act on the short chain triglycerols, and then coming to the digestion in the stomach. In the stomach, what will happen? Lipids are emulsified by peristaltic movements. Okay, digestion in the stomach means here lipids are emulsified. Emulsified means, so due to the continuous movement of the peristaltic movement of the stomach, lipids are broken down into fine droplets. Okay, lipids are broken down into fine droplets, thereby increasing the surface area. That increases the digestibility of the lipids. Gastric lipase is an important gastric lipase is an important lipid digesting enzyme in the stomach. In the saliva, there is lingual lipase is there, which mainly acts on the triglycerides. Even in the stomach also, emulsification done increases the surface area. Emulsification is breaking of the lipid into fine droplets, thereby increasing the surface area. And there is an enzyme is present in the gastric juice, that is gastric lipase. It is important in the digestion of the triglycerides. So around 30% of the digestion of triglyceride occurs in the stomach. Okay, 30% of the triglycerides, their digestion occur in the stomach. Then coming to the next one is digestion in the intestine. So during the after the stomach gets acidic in the stomach, then the acidic food bolus then enter into the small intestine. Okay, duodenum. There it mixes with the bile. Okay, the acidic food bolus from the stomach then enters into the duodenum. There it mixes with the bile. Bile contain bile salts. Name of the bile salts are sodium and potassium salts of sodium and potassium salts of cholic acid and chenodeoxycholic acid. So these bile salts mainly help in the emulsification and neutralization of the acid. Okay, so here first in the mouth what happened? There is a little digestion of the triglycerides has been taken place in the mouth by the enzyme lingual lipase. Then through esophagus, then food enter into stomach. In the stomach, food mixes with the gastric juice. Gastric juice contains gastric lipase. So this gastric lipase acts on the 30% of the triglycerides. Then phospholipids and cholesterol, they will not undergo any change in the mouth and the stomach. This you have to note down. Then food gets acidic in the stomach. The acidic food bolus then enter into the duodenum. There it mixes with the bile. So bile contain bile salts. Now here the bile salts helps in emulsification, breakdown of the lipid particles into the small droplets, and they also neutralizes the acidity of the food. So now here not only the bile, even in the duodenum it will mix with the pancreatic juice. So pancreatic juice, what happen? It contains the enzymes like pancreatic lipase, colipase, cholesterol esterase, phospholipases, etc. Okay, so here pancreatic juice here. Okay, so here the pancreatic juice, it contains the pancreatic enzyme. See here the acidic food bolus, once it enters into the duodenum, it mixes with the bile. Bile improves the digestion and absorption of the lipids because bile contains bile salts which help in emulsification and neutralization of the acid. Then it also mixes with the pancreatic juice. Pancreatic juice contain pancreatic lipase. Okay, and these are the enzymes which help in the digestion of the lipids like pancreatic lipase, colipase, cholesterol esterase, phospholipases. These are the enzymes which will help in the digestion and absorption. Okay, so now here all these enzymes target the primarily ester linkage. Like pancreatic lipase, it acts on the rest of the triglycerides and convert it into free fatty acids, okay, and glycerol. And the cholesterol esterase, it acts on the cholesterol ester to free cholesterol and fatty acid. Phospholipases, it acts on the phospholipids converted to free fatty acids. Okay, like that. See here, see the action of the enzyme. Now the lipase where they are present, which help in the digestion of the triglycerides, right? So mainly your diet contain triglycerides, cholesterol and phospholipids. Triglycerides has been acted upon by lipase. Now lipases, there are three lipases are there. Lingual lipase, and that is present in the saliva. Next one is gastric lipase, that is present in the stomach, and the next one is pancreatic lipase. So wherever it is present, its action is similar. That is, it converts triglycerols to 2,3-diacylglycerol, then to 2-monoacylglycerol, and finally it will convert 1-monoglycerol to glycerol. So that means, what did you understand? Lipases, lingual lipase, pancreatic lipase and gastric lipase, wherever it is present, it acts on the triglycerols and converted into 3 fatty acids plus glycerol. Okay, and what about the cholesterol esterase? It acts on the cholesterol esters to form cholesterol and free fatty acid. And phospholipases, it acts on the phospholipids to free fatty acids plus glycerol. So ultimately at the end of the final digestion takes place in the small intestine. There all the lipids which are present in the diet like triglycerides, cholesterol and phospholipids, they might have been broken down to free cholesterol, free fatty acids, free glycerol, etc. Okay, now coming to the absorption. These end products which are there in the small intestinal lumen, for further utilization they have to transport from the lumen into the blood circulation. The transport of the end products of the digestion from the lumen into the circulation is known as absorption. Okay, so what are the end products of lipid digestion? Free fatty acids, glycerol, like 1-monoacylglycerol, 2-monoacylglycerol, cholesterol and lysophospholipid. What is this lysophospholipid? Phospholipids, when it is acted upon by the phospholipase, gives rise to lysophospholipid. So these are the end products of lipid digestion. What are these? Free fatty acids, glycerol, 2-monoacylglycerol, 1-monoacylglycerol, cholesterol and lysophospholipids. All these which are there in the intestinal lumen, then they have to cross the intestinal mucosal cell and enter into the blood circulation. Now here glycerol, fatty acids only, small chain fatty acids and medium chain fatty acids which are present in the intestinal lumen are directly absorbed from small intestinal lumen into the portal vein and they have been taken up by the liver. Okay, now here all these products, all these will be there in your intestinal lumen. So out of that, glycerol and then small and medium chain fatty acids, they are absorbed from the small intestine and then they have been taken up by the liver. Then the other end products like long chain fatty acids, cholesterol, phospholipids, lysophospholipids, 2-monoacylglycerols are incorporated into molecular aggregates to form mixed micelle. Okay, only the free small chain, medium chain fatty acids and free fatty acids are directly absorbed from the small intestine and they will be taken up by the liver. The other products which are there in the lumen like long chain fatty acids, cholesterol, phospholipids, lysophospholipids, 2-monoacylglycerol, all will clump together, aggregate together and forms mixed micelle. Okay, like that. All will join, see, all will combine with the bile salt to form mixed micelle, and this mixed micelle have been taken up by the small intestine, like they have been absorbed from the small intestine. So only here the role of the bile salt is all the end products. See here, the long chain fatty acids, 2 monoacyl glycerols, all will combine with the bile salt to form mixed micelle. Okay, all these are the like emulsions. They are insoluble in water. They may combine with the bile salt like this to form mixed micelle. In the form of mixed micelle, they will be transported from the intestinal lumen to the mucosal brush border. Once they have been transported from here to here, all will be released into the intestinal mucosal cell, and bile salts is released. Okay, the purpose of bile salts is it help in the digestion by emulsification. Not only that, bile salts also help in the absorption. Absorption is nothing but transport, because from here whatever is there in the intestinal lumen, the lipids cannot transport from here to here. They need some medium for transport. Which medium they may bind is bile salt to form a mixed micelle, and that mixed micelle is then diffused into the intestinal mucosal cells. Once they will reach the intestinal mucosal cell, all will enter into the mucosal cells and bile salts get separated. Okay, once all these enter into the mucosal cell, again, okay, in the intestinal mucosal cells, again the re-esterification done. Free fatty acids again combine with the monoacyl glycerols to form triacyl glycerol. Cholesterol combines with the free fatty acid to form cholesterol esters. Lysophospholipid combine with the free fatty acid to form phospholipids. Okay, so that means why they are all broken down only in order to enter into the intestinal mucosal cell only. They will be broken down into free. Again, once they enter into the cell, re-esterification done. Again, the free fatty acid monoacyl glycerol combine to form triglycerides. Lysophospholipid combine with the these lysophospholipids combine with the free fatty acid to form phospholipid. Cholesterol combine with this one to form cholesterol esters. So like that, all these whatever you are taken in the diet, now they are re-esterified, reformed in your intestinal mucosal cell. From there they will be entered into the blood circulation for further utilization. Okay, all these compounds along with the apoprotein A and apoprotein B48, they means all these one, okay, triacylglycerol, cholesterol ester, phospholipids, once they enter into the blood circulation, they will be transported to their target organs with the help of lipoproteins. Okay, lipoproteins means already you know, these are the transport forms of the lipids, because lipids alone they cannot transport in the blood circulation as they are insoluble in water. So they, for their transportation in the blood, they will combine with the protein to form lipoprotein. One of the lipoprotein is chylomicrons. Now these chylomicrons then enter into the lymph vessels. Okay, so now here like this. Okay, this is intestinal lumen, already monoglycerides, free fatty acids, all will be there. They may combine with the bile salts and will be reaching the intestinal mucosal cell. Once they enter into the mucosal cell, bile salts got separated, all the free ones enter into here, and the re-esterification done result in the formation of triglycerides, again like phospholipids and the cholesterol esters. Then they will be transported in the blood circulation along with the chylomicrons. Okay, the triglycerides which enter into the blood circulation from the intestine, they may be transported to the target. Okay, from the small intestine, the triglycerides are transported to the target tissues along with the chylomicrons. Okay, now here the cholesterol ester which enter into here, okay, small intestine, that may be transported from here to there with the help of like other lipoproteins. Okay, like that, the triglycerides which are there in the small intestine, that may be transported to the different organs of the body with the help of the lipoprotein, that is chylomicron. Okay, that's it about the digestion and absorption of the lipids. So now here there is abnormality. If they, let us discuss about the abnormality of digestion and absorption of the lipids. First one, the steatorrhea. Steatorrhea means excretion of the fat in the feces, that is more than 6 grams per day. Okay, feces fat is directly eliminated from the body through excreted from the body in the form through feces. Okay, that is exceeds more than 6 grams per day. And steatorrhea is mainly due to the defect in the digestion and absorption of the lipids. If there is abnormality in the digestion and absorption, fat may be directly excreted through feces. Usually steatorrhea may be seen in chronic pancreatitis, bile duct obstruction, celiac diseases, sprue and Crohn's disease. Okay, in all these diseases like bile duct, if there is bile duct obstruction, there is abnormality in the digestion absorption. Even the chronic pancreatitis also, fats are not digested because all the final digestion of the lipids is done with the help of pancreatic enzymes. If there is inflammation of the pancreas, there is abnormality in the digestion. Okay, if there is any bile duct obstruction also, bile is not secreted, so that may decreases the digestion and absorption of the lipids. So like in the celiac disorders, if there is any absorption abnormalities, sprue, Crohn's syndrome, in all those conditions, excretion, directly fat is excreted through feces. Okay. The next one is the other abnormalities are chyluria and chylothorax. Chyluria means fat is excreted through urine, that is known as chyluria. Okay, these are the other one is chylothorax. So these are the abnormalities which are associated with the abnormalities of the digestion and absorption of the lipids. So that's it about the digestion and absorption of the lipids. So this is an essay question for you. Okay, the question is asked for an essay. First you have to write about the definition of the digestion of the lipid, then what are the lipids which undergo digestion, like cholesterol, phospholipids and triglycerides. Then what happens to these lipids in the mouth, like stomach, and in the like duodenum, pancreas, and in this one. Okay, pancreas, and final digestion in the small intestine. Okay, and finally after the end products, different end products are formed, and then let us discuss about the absorption, how they will be absorbed, what happens after absorption. Once they enter into that one, they will be circulated in the blood in the form of lipoproteins. Okay, these are the abnormalities. In the next coming class we will discuss about the lipoproteins. So lipoproteins means like different lipoproteins are there, like LDL, HDL, chylomicrons, how they will transport the lipids from one place to another place, and also we will discuss about the cholesterol. Okay, in the next class. Along with that we will discuss the atherosclerosis. Okay, the rest of the topics of this lipid metabolism we'll try to cover in the next theory class. Now here just I would like to add then we will move on to the next topic of the cholesterol, of the lipid metabolism, that is cholesterol is there. So actually as per your syllabus you no need to learn about the how cholesterol is synthesized and how it is degraded. Only you should know how the structure will be and what are the products which are derived from the cholesterol. That much is necessary for you. So first you know that cholesterol is a derived lipid. It is derived from either from the simple lipids or from the compound lipids by hydrolysis. And what is the color of the cholesterol? It is a light yellow color crystalline solid. If you see the structure, there are 27 carbons are there. Okay, 27 carbons are there, and the structure is okay. How many carbons are there? 27 carbons are there. The structure is described as cyclopentanoperhydrophenanthrene ring. Okay, the whole structure of the cholesterol. It is an important short answer question, cholesterol. Then you have to write all the points whatever I am showing now. It's a light yellow color one. It's a 27 carbon compound, and the structure it contains cyclopentanoperhydrophenanthrene ring. Okay, and the whole structure is described, and it contains one hydroxyl group at the third position, double bond between the fifth and sixth one, and side chain at the 17th carbon. Look at this one here, 27 carbons are there. This is the structure of the cholesterol. This you have to draw, and the structure is described as cyclopentanoperhydrophenanthrene ring, and structural features are hydroxyl group is there at the third carbon, double bond between the fifth and sixth one, and there is a side chain at the carbon 17. Okay, and methyl groups are present at the 19th and 18th carbon. This is the structure of the cholesterol. And now coming to the significance of the cholesterol. Normal level of the cholesterol is 50 to 200 milligram per deciliter. Increased levels of the cholesterol beyond that increases the risk of atherosclerosis. Okay, and important component of cell membrane, that it is the cholesterol is the important component of the cell membrane, and it is used to insulate the nerve fibers. So the mainly cholesterol act as a precursor for the synthesis of the bile acids, steroid hormones and vitamin D. Okay, from the cholesterol, three important biological compounds are derived, that is bile salts, bile acids. The next one, steroid hormones, all the glucocorticoids, androgens, all the sex hormones, all the are steroid hormones, they are derived from cholesterol. Even vitamin D, it is also synthesized from cholesterol. So the derivatives of cholesterol are bile acids, which help in the digestion and absorption of the lipids, steroid hormones and vitamin D. You know, vitamin D has a major role in the regulation of calcium and phosphorus metabolism. Okay, and the steroid hormones, okay, you know the role of the steroid hormones in the fertility, etc. So glucocorticoids like mineralocorticoids, regulation of all the metabolic estrogens, progesterones, all the steroid hormones are also derived from cholesterol. Okay, that's it about this one. So bile acids, steroid hormones and vitamin D are derived from cholesterol. Okay, and the structure you have to draw and features of the cholesterol. Then if excess cholesterol is there, that may be associated with the atherosclerosis. Okay, normally 150 to 200 milligrams is there. If excess is there, that may increases the risk of the atherosclerosis. Okay, what happens in the atherosclerosis means here, see here, a normal cholesterol level is 200 milligram per deciliter. If the level is more than that, we can call it as hypercholesterolemia. Okay, hypercholesterolemia indicates increased cholesterol level that may be seen in diabetes mellitus, hypothyroidism, obstructive jaundice, nephrotic syndrome. Okay, the renal disorders, obstructive jaundice, hypothyroidism, and diabetes, there is hypercholesterolemia is there. But anyway, increased concentration may be increases the risk of the CAD, that is coronary artery disorders. So atherosclerosis means it's a term which indicates the deposition of the cholesterol or other lipids in the arterial walls, okay, of the heart, and that may leads to the hardening and closure of the coronary arteries. Okay, atherosclerosis means here the excess cholesterol may get deposited in the arterial walls, and which causes the hardening of this one and narrowing the free flow of the blood, and that may be associated with the coronary artery diseases. See here, atherosclerosis with the blood clot. See, this is the normal blood vessel. If excess of the cholesterol is there, that may gets deposited here. Okay, and that restrict the free flow of the blood, and sometimes that may be completely blocked and causes spasm, so that decreases the flow of the blood to the heart. So blood flow is the heart means lack of oxygen, there is heart to muscle maybe death, that leads to myocardial infarction, angina. Okay, blockage at the, this is a picture which is showing the blockage in the right coronary artery. Okay, and sometimes narrowing of the arteries may be there. So okay, and here this can be, that narrowing artery of this one can be treated by this balloon surgery. Just they will open and clear up the vein passage, and sometimes they do use the stent. Okay, here like the stent will be there, so that prevents the spasm. Okay, that like that we can this one. And treatment of the hypercholesterolemia is, the patient is advised to take consumption of the PUFA. Okay, polyunsaturated fatty acids, more fiber, because more fiber decreases the absorption of the cholesterol, avoiding the high carbohydrate diet, that decreases the cholesterol level. Even drugs like statins. Okay, if cholesterol level is not treated by the physical activity, sometimes doctors advise to take the statins to decrease the control of the cholesterol, that is rovastatin and atorvastatin. Okay, and even sometimes these are the other drugs. Okay, that is cholestyramine or cholestyramine. Like that we can treat the hypercholesterolemia. Okay, thank you. And the rest of the topics of the lipid metabolism, like prostaglandins and lipoproteins and normal lipid profile value, that will continue in the next class. Okay, thank you.
హిందువే సరే డౌటే అంటున్నాను చిన్న వస్తే కావాలి అంటున్నాను వస్తే వస్తుండొచ్చులే అంటున్నాను ఇక్కడ దివసం అనిపించింది అదేమో ఇక్కడ నా బాధగా ఉంటుంది చూద్దా అని అంటావు
¿Quieres sí pensar? Ya, antes de que se la mañana
శ్రీకాంత్ అక్కడే ఉన్నాడు కదా
ఇప్పుడే చేస్తాను క్లాస్ అయితే కదా
ఎవరికి
మేడం తీసుకుంది కదా
ఏమో రాలేదనుకుంటా.
ఇద్దరు ముందు వచ్చింది ఇద్దరు వచ్చింది
ఆ,
నాకు కూడా తీసుకొస్తాను